Hi, I'm Dr. Ada Wells. Welcome to ProBalance. I am a physical therapist and certified Pilates teacher. And today what we're going to be discussing is low bone density. Now, low bone density comes in a couple of names. You might have heard osteopenia or osteoporosis. And basically, if you think about the word osteoporosis, it literally means porous bone. And what we're looking at is the bone. There's two different types of bone in the body. There's the cortical bone, which are like the longer bones, or the stronger bones in your body. And then we have something called like the spongy bone or cancellous bone. That's the type of bone that actually is really at high risk for actually sustaining fractures as a result of low bone density. Now here's a little bit of a scary statistic, but one that you should pay attention to. 50% of women over the age of 50 and about a quarter of men over the age of 50 will sustain an osteoporotic-related bone fracture in their lifetime, okay? That's huge. I mean, like 50% of women have low bone density. So what's important with that is realizing, one, kind of understanding what the risk factors are, and two, understanding what you can be doing about it. So what I want to talk about a little bit here is, first, is just the risk factor, kind of why certain movements are risky, and then what we can try to do to offset what's going on. So first of all, there's some risk factors that we're just not going to be able to do anything about. I mean, age happens, so age is absolutely a risk factor. Our gender, so as I mentioned, if you're female, you're going to be higher risk. There are certain races that are higher, more susceptible. White, Asian, your frame, if you weigh under 127 pounds, that actually is one of the risk factors, so shorter and with a smaller frame. If you've got some family history, that's a risk factor. We can also look at if there's other underlying conditions. Some people who've been on corticosteroid drugs, like maybe they've had asthma or some other underlying medical condition, the types of medications that they may have been taking might have placed them at risk for low bone density. Also, there's differences with regards to hormones. If you've had irregular periods over your lifetime, or maybe you were a long-distance runner and maybe your periods disappeared for quite a while, those all can feed into it. And then, of course, there are different lifestyle factors. Smoking, caffeine, generally those types of things all increase the risk for low bone density. Okay? Now, what are the good things? What are the things that do improve your bony health? It's shown that when we are doing things that are weight-bearing, that are stimulating the bone, that is going to be the thing that actually helps the bone essentially start kind of building itself. We have something called osteoblasts and osteoclasts of the bone, and what that is essentially is you have one that's the bone builders and one that's the bone eaters. And if you have too many bone eaters, that's going to be where you start losing more and more bones. So the bone builders respond to that stress. So that's why things like walking and resistance training are so important, because that's going to be the thing that's essentially tugging on the bone, or the vibration of your tissues when you're actually hitting the floor every time you take a step are things that are actually stimulating the bone. Okay? Now, some people might wonder, well, how do I know if I have low bone density? It's tough because it's called the silent disease because you don't necessarily have symptoms. But there are a few little signs that you can pay attention to see if maybe you might be at risk. Some correlative kind of facts that's been found in the research is that if people have, like if you stand up against a wall and you have more than 7 centimeters from the back of your head to the back of the wall, that's a high correlative feature for potentially having low bone density. So if you really have that big forward head and the rounded shoulders, that might be kind of indication to talk to your doctor and find out if you need to get a bone density test. If maybe you're not, your insurance isn't going to pay for one yet because you're not over 60 or 65. Other things might be actually your rib height, the distance between your pelvic crest to your lower ribs. You can actually take your fingers and see how many fingers can you fit between your lower ribs, which you can feel, and your crest of your pelvis. If you're less than 2 fingers, that's a potential high-risk situation, or not high risk, but correlative feature, because what might be happening is you're already starting to compress in your spine. This relates to the height, your height. If you have lost over 1.5 inches of height over your lifetime, some of that may not just be like, oh, I've lost some height with my discs or my posture. Some of that may literally be your bones are starting to collapse a little bit onto each other. So that's a risk factor. And then just looking, once again, looking at your weight, looking at your overall, your medical history, and just take a look there to see if, like, some of those things might describe me. If that's the case, once again, have the discussion with your doctor to see if it is appropriate to do a Dexa scan or a scan to see what your particular bone density is. When they give you your number, it's usually a T-score, which kind of tells you how far off you are from, when you were at your peak bone density, which is about 30, in your 30s. And that basically is comparing where are you now compared to that. So depending on what your number is, if it's something that's under minus 1.0, you're normal, or, well, your bone density is normal. If it's between minus 1.1 and minus 2.4, you're considered osteopenia. If it's over minus 2.5, you're now considered osteoporosis. Now, how you can sort of remember those numbers a little bit and kind of to give you a little bit of context. If you think about somebody who's minus 2.5 who has osteoporosis, that's approximately 25% bone loss that person has. Person that's got, maybe if their T-score is minus 1.5, it's about 15% of bone loss. So that's kind of a rough correlative number you can also use just to kind of in your mind picture like, wow, what are we talking about when we're talking about bone density loss? Now, let's talk about things that you might do during your day, during your exercise programs that might put you at risk, because we know exercise is good, but you need to be making sure you're doing the right modifications so that you're not increasing your risk of getting these fractures. So we have these different curves in our spine, right? We've got our thoracic kyphosis, which is basically the round part, the middle part of our back. That kind of goes forward. And we have our lordosis, which is basically where the spine kind of moves into a little bit of extension. Those places where that's in extension, because of the way that gravity's hitting you, essentially most of the load is placed more on the posterior structure. So these back parts of the back of the spine, the facets and everything, are the stronger cortical bone. They're good. They're fine with everything. The problem is more of the front side of that spongy bone. And the thing is that if you go into flexion, I'm going to use this ball as the example. If this ball represents your vertebral segment, and if I'm facing straight ahead, would be the segment in my spine. Now, if I bend forward, you can see how the compression is going to be on the front part of that ball. So already in this mid part of my back, if I'm already a little bit rounded in my thoracic spine, I'm already set up to be putting more pressure in the front of that part of the bone that's already losing its density. So you've got a bone that's lost its foundation, and now you're just crushing it there. If we do something that's especially loaded flexion, so thinking about you're bending forward into spine flexion, this is a really high risk position for your spine if you have low bone density, because now we're really loading it up. And so these are the things that you need to be watching for in your daily life. Like how are you bending down to put your dishes in the dishwasher, right? Is it, are you hinging from your hips, or are you doing this little flexion rotation, which not only is going to do things to your discs, also puts you at a really high risk for that low bone density, not the bone density, but compression fractures. Because here's the thing, it's bad to have flexion, but when you add flexion with the rotation, we're now adding this torsional compression to the spine, and that actually can create a lot more compression, a lot more potential for fracture. So let's look at some of the things you might find in a Pilates class, for example, okay? In a Pilates class, you might be doing some exercises, and there's a lot of flexion in an exercise in a Pilates class. So they might be doing chest lifts, or you're doing the 100, or you're doing crisscross, which is rotation flexion. You might be doing things where you're reaching out. All of those exercises put you at a very high risk for potentially fracturing if you have low bone density. Okay, now let's look at the things that maybe you didn't think about too much. Oh, okay, maybe it's time for child's pose. And if you're going into flexion, you can see how my spine is bending forward. That's putting it at risk. Okay, So what is okay is going more into extension, because like I said, when we're moving into extension, we have the strong part of the bone back there that's taking up the compression, okay? So let's look a little bit at our other motions. So we talked already about how rotation and flexion together can really be a problem. Now, if you're rotating and you're neutral, that's not as bad, okay? And if you're rotating in extension, that's fine. But it's that rotation in a flexed position which is going to really wind up the bone and potentially compress, okay? The other thing is thinking about things like side bending. So, you might see an exercise like mermaid, which there's two things in a mermaid that could be a little dicey. One is if you tend to be really, really tight in your hips and you're already at end range here, we're essentially torquing that hip bone or that femoral neck. If you can easily sit there, you're probably fine, okay? Now, when we go over into a side bend, if you're thinking about reaching over, we're going to be getting a lot of compression at the lumbar or at the side of the vertebrae here on the shortened side, versus the other side is getting lengthened. But that's one of the things too, is if you are side bending into a pretty large range, that could be problematic. So usually when I'm teaching a Pilates class, I'm teaching any sort of exercise class, and I know my population falls in that over 50, there's just some things that I just add to the conversation. And one is that if you basically keep your spine either neutral, which essentially, if I were to take the stick here, this little dowel, place it on my spine, and I have the pressure on the back of my head, the middle of the back, and at my sacrum, my tailbone area. If I go ahead and I bend forward and I still have the same spaces, I've maintained a neutral spine. So I can rotate here, I can do all sorts of, there's a lot you can do in a neutral spine position, okay? Now, if my spine comes away from that, I've now gone into flexion. So that's kind of a little, if you're kind of unsure about flexion or extension, that's what we're looking at. Now, when you are in an exercise class and they do start doing things where they're lifting up the head into that flexed position, you're going to have to stay down. Now, guess what? Does that make the exercise easy? It actually makes the exercise more challenging. So guess what? You're going to get more of a workout. So thank your instructor. But yeah, if they're doing things where normally it would be a crisscross and we're now going into flexion rotation, you'll want to stay down. Now, you can do your crisscross from here, and I'm still working. I'm working hard, but I'm no longer going into extension. The same thing with any sort of roll-ups where people are rolling up, rolling down. Those are absolutely contraindicated for somebody that has low bone density. You'll want to do a modification where maybe you're doing a hinge and back up. And while everybody else is rolling, you may be doing something where you're doing some toe taps or something where you're essentially not creating that flexion in that spine. So there's certainly a lot of exercises that we can do that don't put the spine into flexion. There's also some great exercises you can do that really improve your bone density. So what has been shown is doing exercises that are resistive and that are really working the backside of the body to keep you more upright. That's going to be really helpful for just improving not only your posture, but just basically relieving the pressure off those front segments. The other thing is doing things that just improve your overall balance. So once again, you don't run into that situation where you potentially trip, fall over yourself, and end up unwillingly having a fracture. So anyways, I hope this was helpful, just as a little bit of a PSA to understand the importance of having some awareness of the fact that once you are over 50, bone density is something to consider, but also that it is something you absolutely have power to be able to still have a really long, healthy, active lifestyle, and in fact, those things will help you in the long run, okay? I'm Ada Wells, and I will talk to you later.